Cutting-edge treatments of addiction. First, I'd like to begin by introducing you to the models of addiction and how they affect the treatment outcomes. The first model is the moral model. Within this model, addiction is viewed as a consequence of a personal choice. This model has been adopted by religious and certain legal systems. It is viewed that this behavior is sinful, and some religious groups prohibit the use of drugs, such as the Mormon Church. From this perspective, religion or spiritual intervention would be necessary for the behavioral change. Sociocultural model. This model focuses on factors that are external from the individual, such as culture, religion, family, and peer variables or psychological factors. Typically, teens are most common at risk for developing sociocultural model of addiction due to peer pressures to try and to hopefully fit in with their group that they're hanging out with, and they end up using substances not understanding the full concept of what they're doing to their body and the changes that are going on within their brain. The third model is psychological. In this model, addiction is seen as that it's a secondary issue. The primary issue is a psychological problem, and it causes emotional pain, and the alcohol or the drugs serve as a temporary relief from this pain. The disease model. The disease model is very popular, but also controversial right now. It is used in AA and NA programs and is the guiding model for a lot of treatment programs. It is seen that this is the primary disease and that it exists within itself and is not secondary to another condition. Often people from this model believe that if they ever touch alcohol again, that they will die and that it will continue and that there is no cure for it. The biopsychosocial model kind of integrates the biological portion of a person, the psychological portion, and the social portion of the other models that I have already previously discussed. What are typical treatments? Common treatments for addiction are 12-step, AA and NA meetings. It's a free membership. You go, you discuss your issues, desires, triggers, and you're with peers that are in your community that hopefully have an understanding of what you're going through. That was the whole goal of the development of AA and NA, is to provide peer supports. It is common that sponsors are associated and people can rely on them when they're having issues outside of group meetings. Peers also facilitate these groups. They typically don't have any training in psychological groups, and they go to learning sessions and are taught how to make sure the group is running at least smoothly. The next one is individual therapy. This is very common. Common therapy techniques that are used in individual therapy would be CBT, discussing with clients the cognitive thoughts that led to the behavior and how to go back and change those thoughts to be what they want them to be now in order to change the behavior and to create a lasting change. There are other group therapies that are available, such as a process group or a cognitive self-change group. Also available are family therapy. Some new options. So there's this MPACT program that was developed in 2006 in the UK. It's designed to assist families that are experiencing parental substance misuse, abuse, or dependence. It's designed to have children ages 7 to 17 that have parents or grandparent that they're living with that is experiencing a problem with a substance. It's designed to have them come in and to have that universality and to have an understanding of what other kids are going through. Also, parents during this time are taught parenting skills, how to set boundaries with the kids, how to handle difficult situations. And also, what's really cool is that the kids are taught how to develop a safety plan. So what to do if their parents are using a substance and they overdose. Who do they call? Do they go to a neighbor? What do they do? What can they do to help their parents get out of that situation? Another technique is brain mapping. It's a tool that has been designed to individualize treatments for people. It observes drug-related biochemical changes that directly relate to cognitive and behavioral deficits using EEG type of equipment, and it identifies imbalances in the brain. These imbalances, when individualized, apparently clinicians are able to take and to work with them in session privately on how to rehabilitate themselves in such a way that they are using the data from the mapping and understanding how the cognitive and behavioral deficits have led to their addiction, how to get them out of their addiction, and what changes need to be made. Biofeedback. Biofeedback, or also known as neurofeedback, is a therapy where patients learn how their brain waves are patterned. And it changes brain waves, and it says that it can be beneficial and affect to reduce stress and relaxation, and to help individuals learn more about the biochemistry of their brain and what's going on. Because when we use drugs, as we learned in neuropsych and as we learned in psychopharmacology, it changes the structures of our neurons and the firings that happen in our brain. And we no longer are capable of really understanding that once we're in that little fog of being on drugs. So it's important to bring the person out of that and have them recognize what the effects have been on their brain in order to reverse, if possible, or to at least alleviate some of the symptoms that may come with it. Pharmacogenic testing. I'm not really sure how to say that one. Sorry, Malden. It's the study of genetics. Like we learned in neuropsych, our genes have an effect on our neurons and our cells and how they are developed and the pathways that are developed and things that are going on and firing within our brain. And it's ensured to find out if the client is able to take certain drugs and what drugs will hopefully benefit the client. Will methadone help? What about aversion therapy? There's very different medications out there that can help an individual with an addiction, especially if they're coming from a psychological model where it is a secondary issue, that they do have a primary issue, that maybe it was anxiety, maybe it was depression, maybe they have some PTSD and they're trying to forget. There's various types of issues that could lead to maybe why they would want to do this testing in order to make sure that the client is receiving the correct medication and they're not reaching toxicity. And they're not going to have as many negative side effects, which could potentially lead to early discontinuation and could potentially even lead to a relapse. It is very important that once a person who has an addiction is in treatment, that we keep them in treatment. We don't want it to be too complicated for them. We want it to, be easy in the way that they can access the care that they need. We don't want it to be super difficult, because as soon as it gets difficult is when likely they're going to take a step back and be like, it's not worth it anymore. I'd rather just be using. And it's a trigger. The next interesting new information that I have found is a program that is called the Enter Health Continuum of Care, which I find very interesting. So they say that 60% of people who have successfully completed traditional forms of treatment will relapse within the first year. The leading cause of relapse is failure to follow with the prescribed continuing care that has been set up at the discharge. So people that are going into treatment centers, they're getting their care for a month, 2 months, and then they're not following through. Or they get out and 6 months later they're like, hey, I'm good. I got 6 months clean. This is the longest I've ever been. And they no longer continue. What Enter Health is trying to do is they're trying to meet the challenge by developing science-based treatments and models to provide philosophy and key points to these people while they're in treatment centers in order to lead them to continue the path of sobriety. What they try to do is they have a more structured portion. They have the ranch, which is the residential rehab facility. Then they have transitional living that their clients will transfer to. And then from there, they'll go to intensive outpatient therapy, which consists of at least 4 days a week with 2 hours at a time. It's very intensive, but they're out and about. They're encouraged to go to AA, NA meetings, whatever is needed to continue with their sobriety. And then it goes to a little bit less structured of just outpatient support, where this would probably be like once a week sessions for a while, then maybe bi-weekly, and then leading up to monthly, and then maybe even every 3 months. Their goal is to eventually get the person to a point where they no longer necessarily need the treatment, but they're there and they have the opportunity to go back. And they really, our clients are finding that it's really helping them. So their model is based off of the patient. And that goes to, their first step is to make sure that the individual has withdrawn and they're stabilized within their detox. They do some neurological testing and some treatments. They do psychiatric dual diagnoses if necessary, co-occurring medical diseases, as it's very important that once a person is off the substance to really look at the issues that they have. You know, were their issues substance induced, or were they actually induced by a biological or neurological factor? You know, what other things have they contracted too? You know, you have to really understand, you know, when you're working with IV drug users, there is potential that they could have Hep C or HIV or even, you know, AIDS at that point. It's very important to take the whole individual and to look at every factor, not just say, okay, we're going to look at your family and we're going to look at you and we're going to call it good. Their next step is to do anti-addiction medication when necessary. So that would be relating back to, you know, aversion therapy, where you can take a pill and if you drink, it makes you violently ill, which hopefully the goal is to deter you from drinking drinking and continuing with that medication and drinking at the same time because you're getting violently ill. Who wants to get violently ill? There's also other medication that can be prescribed, such as methadone, and that's commonly used for individuals with heroin addiction or other opiate addictions. They like to implement group and individual therapy, family therapy, in a group sense and within individual settings. So meaning that the family can come in and they can talk to the therapist alone with the client, or they can go to a group therapy such as the Impact kind of program. They're also encouraged to do AA, NA, or spiritual support. They like to typically help develop wellness plans and set up nutritional plans, because often it's important that these people that are in recovery are receiving their needs that are being met. You know, you have to make sure that they're getting the right amount of food in their system. If they're exercising, you got to make sure that you're increasing their food intake, because, I mean, they may not have been eating very well properly, at least before. And also there are negative side effects to methadone. You could gain weight, so making sure that they're monitoring what they're eating and how many calories they're consuming to make sure that they're not gaining an extensive amount of weight and then quitting taking the methadone. Another strategy that they like to use is life care tools and support. So helping these individuals find jobs, find homes, becoming stable, reintegrating back into society as, you know, what would be classified as more of a normal person, and just helping them in ways that other programs maybe haven't been. Because most programs, like I said, you go in for a month, and then after, it's kind of up to you as an individual whether or not you're going to continue with the discharge plan. Nobody's there to force you unless you're court ordered. And I think that this has been a very great program that they have implemented. Please let me know if you have any questions.